Hi, everyone. Welcome to my, I guess it's my third presentation now. And today we're going to be talking about understanding stuttering in young children. Um, what we'll be discussing today is some background information on stuttering. What is it? What causes it? Different types of stuttering and some examples. What are some myths about stuttering? Because I know there is a lot of information out there about stuttering, and tips on facilitating fluency if you do have a child that's experiencing some disfluency. What are things that you can help your child along? Stuttering, or sometimes you'll hear me say disfluency, has been around for centuries, and throughout history, there have been supposed famous people who have stuttered, such as Marilyn Monroe, Winston Churchill, Rowan Atkinson, Bruce Willis, and Tiger Woods, just to name a few. And what is stuttering exactly? Stuttering is a speech disorder characterized by disruptions in the flow of speech. Um, and I do have this next clip as an example of a little one who is experiencing a lot of difficulties. You may have seen this a little boy on a commercial. Sometimes it's seen as a funny meme, but this is an example of a child having extreme difficulties with his fluency. I'm going to try to fix that because I don't think you can hear that. Give me 1 second. Of course, technical difficulties always at some point. Let me fix that. There we go. I'm going to go back into that, and then should be able to play it again. Let's try this again.
Have you ever had a dream that you could do so you want him to do you so much you could do anything?
So I think that little guy is adorable, and like I said, I have seen it popped up on many things, placed in like a funny way of a child who stutters. But stuttering is very complicated. It's a complicated issue because there is no one single cause, nor is there a simple solution or a cure of how to fix it or best help these children. Stuttering occurs in all races and languages. Boys are more likely to stutter than girls. Onset may be sudden or gradual. Stuttering may be mild to severe, and I would say that the little guy in the video that you just listened to would be in the more moderate to severe range. There may be fluctuations in your child's fluency, so they might be fluent 1 week, and then the next week they have a lot of disfluency, and it can go back and forth. About 5 to 10% of preschool age children experience stuttering at some point in their life, and approximately 1% of adults have ongoing stuttering problems going into adulthood. Sometimes you might hear spontaneous recovery. Spontaneous recovery is when a child regains their fluency, speech fluency, without any intervention. Not everyone will recover spontaneously, but there are some predictors that might suggest that you might not have to jump into intervention right away. Females tend to experience spontaneous recovery more often. Family history of spontaneous recovery, and if it's an early onset. So if you see stuttering starting like at an early age, 2-3 years old, if you see stuttering starting when the child is older, maybe in grade school, there's less likely that it would be able to recover on its own without some type of intervention. Spontaneous recovery usually occurs within the first 2 years of onset. And other speech and language difficulties may make spontaneous recovery difficult. So if the only difficulty the child is experiencing is disfluency, there may be a chance of spontaneous recovery. But if they also have language difficulties, speech difficulties, literacy difficulties, then spontaneous recovery might not be apt to happen. And I put a little note down at the bottom saying early intervention is the most effective predictor for recovery if you're truly concerned about your child's fluency. Not all disfluent speech is stuttering. So as I mentioned before, there is normal disfluency in childhood, and there's stuttering or disordered fluency. So can you tell the difference? For normal disfluency, disfluencies are expected and are attributed to learning language. So as a child is developing and learning more vocabulary, more words, starting to use string more words together, there may be a period of time where they stumble on their words as they're trying to think of the new vocabulary and using more words together. Usually seen between the ages of 2 and 6 years old. And this might be the child repeats syllables, they might repeat whole words, phrases, a lot of uses of interjection, which are saying or ah a lot. And the disfluency may last several weeks, but usually goes away in time, usually within 6 months. So as the child is able to use that new vocabulary better, and they're used to saying more words together in a sentence, their disfluency usually gets better over time, and then there's no need for intervention. If you see a child who, the child can be at any age, but if there are multiple disfluencies while speaking, like 5 disfluencies per 100 words, it's more often, you see it more often. The child, again, repeats sounds, usually syllables 3 to 4 times, pauses for more than 2 seconds between words, or prolong sounds out. And I will show you a few clips on what I mean by that, what it would sound like if you're prolonging sound, if the child's prolonging sounds. And the child may show other behaviors during stuttering, so groping, facial tension, a mouth wide open. I might have a little clip maybe of an individual doing that. So if a child is having other secondary behaviors, not only just fluency, but they're grimacing their face or they're holding their breath, that's another indication that it might not go away on its own. So here is a clip on what a typical toddler learning language, what normal stuttering you might see in your child or other children you're around that probably wouldn't need intervention. I'll give this a play.
All children have repetitions, hesitations, and disruptions in their speech when learning to talk. We call these disfluencies. They may have more of these when they're using complicated language, or are tired, excited, upset, or being rushed to speak. Let's take a look at some normal repetitions that most children have as they are learning to talk.
We all were trying to find him, and you know what? We let them go so they can find their mom and a new home. And when tonight, I got this bowl for my family.
So she's a cute little one. And you could see that she's trying to tell a story. So she's also trying to think of what she wants to say at the same time. At some point she's talking a little bit faster. And so she gets messed up a little bit while she's speaking at the same time. But as the woman pointed out in the video, that is an example of what normal disfluency would look like for a toddler or someone who's learning language for the first time.
All children have repetitions, hesitation.
So there are different types of stuttering. There are multiple types of stuttering. Part word repetitions. So that's when a child would say, what do you want for dinner? Whole word repetitions where they repeat the same word, like mom, may I go here? Prolongations, which are I want to do that. And there are also things we call blocks. So that's when the child is actually closing off the breath as they're speaking, like I want to do that. And I think that I do have a little bit later a few examples of that. And again, like I said, here are some examples, and I can make these slides available later too, of what that might look like. And then at the bottom of this slide, it says tension. So a child may show that increased muscle, lip, tongue, throat. You can see them tensing up when they're trying to say a certain sound or a certain word. So when should you become concerned? I think there's going to be maybe a woman too at the beginning of this little video too that talks about what some different types of fluency that maybe you want to seek professional's opinion, or go to your family doctor to see does this seem like something that would need some form of intervention.
We become concerned when children have more frequent and longer repetitions, like this, and prolongations of sounds like mommy, or they may block on sounds and words with no sound coming out at all, like this. Some children who stutter may also have behaviors such as eye blinks, looking away, or physical tension around their mouth or other parts of the face. In addition, some of the struggle and tension can be heard as a rising pitch, like this. Here are some examples of children stuttering.
We're going to put this over his head so his head doesn't get hurt. Well, when I grow up, I'm going to be a policeman like Daddy. It's for me.
Oh.
My dad is
And maybe I can call them back later.
I think y a mí me gusta el lema es porque quiero tener cuando él dice algo es porque es verdad.
And what I like about those kids, who are also very, very adorable, is that the one child that was demonstrating the blocks, so he was blocking off the air, obviously was speaking a different language. So again, it happens, and I just did it there myself as I was trying to think of what to say. Adults do it as well. Different races, different languages. It happens in all walks of life, and it can happen at all ages. What causes stuttering? The cause is unknown still, but research suggests there's a problem with timing and coordination of the speech structures, the lips, the tongues, and the vocal cords somewhere along the line. It's influenced by a combination of environment, personality, and genetics, and it does happen, or they have found out that it does run in families. So between the environment, the personality, your genetics, whether you're a boy, whether you're a girl, all kind of have to come together to kind of create a situation that possibly a child might stutter, but they still are not sure of what the cause is of stuttering that we can actually point out and point towards it. There are a lot of myths about stuttering, however, and you may have heard some of these that are coming up, but I wanted to talk about the myths of stuttering and dispel any rumors that you might have heard, or just anything really about stuttering in general, because there's not a lot known about it, and not a lot of people know about stuttering. And so I wanted to talk about that for a little bit. So myth number one is that stuttering is caused by nervousness or anxiety. While anxiety can intensify the stuttering, because it does talk about that combination of personality, it is not the primary cause. Stuttering is a complex speech disorder that may be influenced, again, by genetics, brain structure, language processing. Anxiety can make it more noticeable, but it definitely is not the root cause of what is causing the fluency. Hearing other people will make my child stutter. And children do not learn to stutter. It's something that might come on suddenly, and it's not, and it may not be in your family, and it may be in your family. Again, there is a genetic component, but a child could start to stutter, and you don't know anyone in your family that is stuttering at that point. Stuttering is just a habit and can be easily broken. Stuttering is not a habit, and it's something that someone just can't snap out of. I've also heard, and I can't remember if it's coming up in the slides, but people saying, "Oh, they're just being lazy," but that's not the case. It's a neurological condition that requires understanding, support, and therapy. I have heard this one, that children who stutter are not as intelligent as other children. So stuttering has no connection to intelligence. People who stutter can be as intelligent and capable as those who don't. Stuttering is a speech disorder and is not a condition of a cognitive ability. And as I said in my opening statement when I started this presentation, famous intelligent people like Sir Isaac Newton, Winston Churchill, Emily Blunt has also talked about that she used to stutter as a child, and so has Rowan Atkinson. So it definitely has no connection to a level of intelligence. If someone stutters, you should finish their sentence to help them. Finishing someone's sentences may feel like you're helping them, but it can make them feel more frustrated or self-conscious. It's better to be patient and give them time to speak. I've spoken with many children who stutter and adults who stutter, and they say one of the most frustrating things is when they're trying to tell you something and someone guesses what they think they're trying to say and are trying to be helpful with finishing their sentences, and oftentimes it's not correct. That's not what they were trying to say. So it does make them more upset and frustrated. Myth 6, learning a new language or two languages will make my child stutter. Bilingualism does not cause stuttering and does not increase the chance that your child will stutter. So if you had any concerns of whether a lot of kids in this province might go into French immersion, or if that will help or hinder if a student is already stuttering, bilingualism does not and should not hinder a person's recovery from stuttering or cause stuttering. What are some factors that influence fluency or stuttering? Some physical factors. Stuttering runs in families. As I talked about, a family history of stuttering does not necessarily mean that your child will stutter, but there usually is a connection. The sex of the child. Boys are more likely to stutter and less likely to recover spontaneously than girls. I would say that in my years of being a speech language pathologist, I have seen 50% more boys than girls. And I believe in the last 5 years, I might have had 5 boys who had stuttered and 1 girl. For some reason, it does run more in boys. And a child shows distress or awareness to his or her disfluencies can exacerbate the difficulty. So when the child is really young, they might not notice that they're actually having a difficulty. As the child gets older, it also might be a factor that might dictate whether you seek a professional treatment or help, is when a child starts to become frustrated and shows awareness and starts to shy away from talking, for example, in class. And that can make the stuttering worse. Language factors. If there is any delayed in speech or language skills, high language demands may cause your child to become stressed, which may cause his or her speech to break down. So again, if for some reason, even doing this presentation myself, I'm sure if I watched this back, I'd be horrified, mortified, but I can tell it sometimes when I'm trying to think of exactly what I want to say. I can trip over my words sometimes too, and I can hear myself repeating some words. So if there's a demand, or they have to go into a play, or they're just asked a question and you need an answer, that you might see it then. Putting high language demands on your child is when you talk in long sentences, you talk too fast. You might use more complex vocabulary. They're interrupted, or when you ask too many questions at once, like you're firing questions back at them and they're trying to think of what to say, and might get a little bit flustered, and that's when you might see more stuttering. Situational factors. So your child's personality, for example, is your child a perfectionist? Naturally, your child's personality will affect his or her fluency. Sensitive children are more likely to continue to stutter and less likely to recover spontaneously. So again, it isn't because of anxiety, but if a child is experiencing anxiety, it might exacerbate the problem. Your child's feelings and emotions. Is he or she tired? Are they sick, nervous, angry? This might affect their fluency. The environment may also put stress on your child's speech and motor system. So environmental factors include a hurried environment. For example, if you live in a big family and there's 10 kids and somebody is trying to say something and they feel like they're rushed and hurried and they need to get their point across right away, that could be a hurried environment. Needing to compete for attention. The child feels like he's ignored when he or she tries to talk, or people tease or try to correct him or her when they're talking. What can we do to support children who stutter? So if you do have a child with dysfluency, and maybe they're not seeing a speech language pathologist at this point, what can we do at home to support and at school our children who are experiencing difficulties in this area? So we have environmental modifications. So environmental modifications do not focus directly on changing the child's speech, but it changes the environment that the child is in. So it makes changes to the child's communication environment to facilitate a more fluent speech environment. And we want to enhance communication confidence in our children, and we want them to feel comfortable being able to talk, especially in school as they get older and they're reading out loud or they're doing presentations. We want them to be more confident. So what can you do to help as a parent? So we can encourage a calm and supportive environment, be accepting of your child's stutter, encourage a positive reactions to stuttering. So not reacting negatively or, teasing when the child stutters. Model a relaxing speaking style and reduce the time pressure that the child may have. Again, if there's a big family, reducing that time pressure, maybe spending a chunk of time just with that one child. They don't feel like they're rushed. Let's see. When a child feels rushed to speak, their stuttering can increase, and simple changes is just slowing down the environment could help a lot. Why is talking more slowly and pausing is helpful? It gives your child more time to think and plan what they want to say. It makes speech easier to understand, especially if a child also has language difficulties. If you're speaking more slowly, it will give them time to listen to what you're saying. It gives the sense that there's enough time. There's no rush. He or she doesn't need to rush to think about what to say before you're possibly off to the next thing. They can go at their own pace, and it encourages more talking more slowly and using pauses in between thoughts and ideas. What do I need to do differently in order to talk slowly and to make use of pauses? It's funny that I put up the slide, and I added this slide because I have a parent who, after talking with her about slowing down, it seems like an easy thing to do, but it is hard if you're used to talking and you are just used to a fast-paced environment, and slowing down, it just seems so unnatural. And it can feel weird if you are used to being a fast talker and you're trying to train yourself to talk more slowly. It can feel odd at first. So what you can do is you can listen to how your child talks when he or she is relaxed and calm. And we kind of can pace ourselves on that pace of how your child talks when they are relaxed and calm. Yeah, try to go about the same pace or even a little bit slower, again, which might feel weird, but going a little bit slower than how your child talks. Try to pause before saying something as well as between sentences. So really pacing out your sentences or ideas. Tape record yourself is an interesting one, and it might help to listen to how slow you are or how fast you talk. and how you can make changes yourself if you listen to yourself when you're speaking naturally. And then even though you are talking slowly, try to sound as natural as possible and not choppy like a robot. It's easy to get stuck into the hi, how are you, and talking, but try to make that the cadence of language and for it to sound as natural as possible. And remember, talking slowly or pausing, again, may feel strange to begin with, but it takes practice. And it seems funny to say that because again, it seems like oh, you just want me to talk slower? That's fine, that's easy, but it does take practice. So when should I talk to an SLP? So you might be watching this presentation and think, yeah, my child does some of those things. I don't know whether to be concerned or not. You might be here because you already do have an SLP and you do have a child that you know is struggling in that area of dysfluency. But if you haven't already sought out help, then if stuttering persists more than 6 months, or if it increases in severity over time, that's a good idea to consult a speech language pathologist to see what the next steps might be. Your child, if they're starting to display negative reactions towards their stuttering. So as they get older, as young children, it might not affect them at all. And as you said, as you saw in some of those videos, the children experienced a lot of dysfluency, but they just continued on playing and nobody seemed to get upset or frustrated or cry even that they were having difficulties getting their word out. But if you start seeing that frustration and anxiety about talking, it would be a good idea to seek out an SLP. If your child has difficulty communicating with others due to their stuttering, so if it's starting to affect peer relationships, if you've noticed that, they're shying away from other children, again, mainly because they're probably more aware of it and have anxiety around it, it might be a good time to search out an SLP. And anytime you are concerned or have any questions about your child's speech or language or fluency, it's a good time to either speak to your family doctor or seek out an SLP to ask any questions if you're concerned at all. And if you've watched any of my other videos, there's a key theme throughout all my videos, and that is interaction is key. And if I was doing this in front of a group of people, it would be more like a Jeopardy style, but I have put together a few true or false questions. Might seem weird that I'm going to read them through and I'll read the answers too, but just to kind of like a recap of some things that are the key information in this presentation of what I want you to take away from the presentation today. So true or false? One of the best ways to slow a child down and to help them be more fluent is to remind them or tell them to slow down and start over. And of course, that is false. The best way to help is for the adults in the child's life to model that talking slowly or to use more pauses. Especially when the child is younger. There are later fluency techniques when a child is older, and I'm not going to talk about those today, but because most of the children in our program are on the younger side, we try to modify that environment as much as possible to help them be more fluent. So having the adults in their life, the teachers at school, the EAs, and at home, again, the best way is for those people in the child's life to model that slow talking and to use more pauses. Even as I'm doing this presentation, I have to try to check myself and to remind myself to pause, take some time, don't speak too quickly so that you guys can understand more what I'm saying as well. True or false? Boys are more likely to stutter than girls. And I've mentioned this a few times, so it's true. While the exact reason isn't fully understood, boys are 2 to 3 times more likely to stutter. True or false? Not all dysfluencies seen in young children are considered stuttering or is stuttering. And that is true. Disfluencies are expected in young children and are attributed to learning language. It may last several weeks, but should go away in time. True or false? Stuttering is caused by emotional problems. And of course, that is false. Children who stutter are no more likely to have emotional problems than children who don't. There is no research that says emotional trauma causes stuttering. Excuse me. True or false? I heard that people don't stutter when they sing. This is actually true. Research suggests this could be due to many factors, including the rhythmic nature of singing, the use of different parts of the brain when you're speaking versus singing, and the fact that singing is usually memorized, like a song, poem, and it's easier than being spontaneous, like speaking, or you're trying to make up a story on the spot. So this is actually true, and it's very fascinating to watch. I wanted to leave you with a little bit of homework as well, just something to try, especially if you are having any concerns about your child having disfluency issues. Think about your own speech rate and how often you may take pauses. Here are some questions to ask yourself and to reflect on. So when playing with your child, what speed does he or she typically talk? Is she a fast talker? Is he or she a slow talker? Do I talk as slowly as my child, or do I talk faster? Do I use pauses when I talk, or do I just keep going and say sentence after sentence after sentence with barely little pausing? Why might it be helpful to think about my rate of talking and make use of pauses when talking to my child? So as a note, you and your child do not necessarily speak faster or slower than anyone else. However, a child who stutters usually finds it easier to be more fluent when he or she is speaking more slowly. Each child is different. You can help your child to take his or her time when talking by, again, modeling that slower rate, using more pauses, particularly if you're a naturally fast talker and talk faster than your child does. Practice reading a book to a partner or your child with a slow rate. Books are a great way to start because, it gives you a focus point, it gives you a beginning and an end, and it helps you pace what you're going to say. So what do you observe when you're reading slower to your child? What, if anything, with this lens in mind, thinking about reading slower and taking more pauses, did you do anything differently when you're reading this story today versus if you've read the story in the past? And was it easier or hard to slow your rate of speech down? Here are some resources where I've got some of my information from. And again, I will make my slides available that if you don't want to take notes or you want to go back and just read over anything, I will make them available to you after the end of this presentation. So thank you so much. And if you have any questions at all, contact your SLP. If it happens to me, be me, for sure, reach out to me, or I'm sure any of your SLPs would be happy to answer any of your questions about disfluency or any questions about speech and language in general. Thank you so much.